I come from generations of farmers, my both grandparents on each side. And we did raise tobacco. I come from that heritage. So I was aware of some of the hazards and so forth, but actually became a nurse, and I taught nursing for a number of years. I had an opportunity to be a regional coordinator for a Kellogg grant, and it was to mobilize farm women to address health and safety. It was one of the 12, I guess, of the Kellogg projects for the Ag Initiative. From the Kellogg grant, that went on for probably 3 or 4 years, and I was still teaching nursing at the time. And one of the most unfunded projects that I did, and we had been told this would not work. Anytime you tell me something won't work, I'm determined to make it work. So we designed a simple little survey, and we used public health nurses, community health, public health students. So we identified 10 sites in our county, in our local county, where farmers gathered for their breakfast, and early in the morning, we went and we had coffee with them. We used blood pressures to get them to buy into the program, and over 300 were hypertensive, if I remember correctly. I mean, it was quite high, let me just say that. But the survey was so interesting because of the 10 sites, 7 of them that chose stress as their #1 topic of concern. The students then designed posters, educational posters, and took back to these sites. It was really an interesting experience and told us a lot about farmers and the culture, and that was probably the best thing that came out of it, is the students in the end had an appreciation for these individuals and what they contribute to our livelihood and our economy. And then from that, I decided to go back and do my dissertation. And I actually did my dissertation on respiratory issues associated with farmers and their decision to wear a respiratory protection or not. And from that, we adapted that survey instrument that I created with focus groups, and we did a hearing study trying to encourage farmers to use hearing protection. We looked at our Kentucky farmers. Are they prepared for emergencies? Do they know CPR? Do they know first aid and so forth? I worked with Dr. Deborah Reed from the University of Kentucky. She had funding, I-SASH funding, and my part a few years ago was developing a course in agricultural health and safety, and it was an academic course. And we had students take that, and then from that academic course, we have developed 2 different continuing education programs. One on an emerging population in agriculture, and that's the Amish and the Mennonites or Anabaptists. And the other one was the mental health issues associated with farming. And then from that, I get up to the current project that we're working on. We were so fortunate in Kentucky that Brandon Reed, he is a representative. He was able to get tobacco money, which I think is very, very significant. And there's several projects that are ongoing now to address mental health issues and the suicide prevention in rural areas. So our thesis is, or hypothesis, farmers, they usually define their health as the ability to do work. And when they have some type of symptom that they cannot work, they may go to a rural healthcare provider. And they may be experiencing stress and mental health issues, depression, but many times they go with physical complaints. And it's very important that healthcare providers in rural areas know about the stress that farmers are under. And if they're more aware, perhaps they can identify these issues early and get them into treatment before the suicide event occurs. So this is our goal now, and we are interviewing with farmers, trying to get that lived experience and what can we do and what can we put in this health CE program that we're developing that will be made available to all healthcare providers that deal with farmers. I think it's important that we all listen more in whatever we're doing. You know, we've been given 2 ears and 1 mouth, which is a subtle hint we need to listen more than we talk. So relationships and the communication is very important. Again, you can't deny the formation of relationships. I mean, that's just at the top of the list as far as I'm concerned, that interaction.